I don't really know what is happening, but I can tell my mother is really worried.
My hands are broken. It is so hard to work. And my eyelid, you can see, does not work very well.
When the doctor told me I had leprosy, I cried and cried. Who will care for my children? Will they be left all alone?
Leprosy is one of the most feared diseases in human history. For thousands of years, leprosy has disabled and condemned to exile those who've suffered from it. For centuries, there was nothing anyone could do to stop it. But today, there is a cure. The Leprosy Mission is an international Christian development organisation working to cure, rehabilitate and empower people affected by leprosy. Working towards the achievement of the UN Millennium Development Goals, we have programmes in around 30 countries across Africa, South Asia and Southeast Asia. Our network of partners covers areas where leprosy and poverty are widespread, enabling us to target those who need us most when they need us most. We've been challenging injustice and tackling poverty in the name of Jesus in some of the world's poorest and most marginalised communities since 1874. When it first strikes, leprosy looks innocent enough, usually just a small patch on the skin. Inside the body, though, the leprosy bacilli begin attacking a child's delicate nerves. From here on, doctors only have a few months to treat the disease before it begins to permanently destroy. If left untreated, leprosy kills the sense of touch. Without feeling, a person easily injures hands and feet. Paralysing deformity and clawing appear. Soon, dangerous ulcers affect the tissues and bones. Bone absorption can turn what is left of a woman's limbs into useless stubs. As leprosy moves through the body, it can brutally deform a youngster's face. Later in life, noses can sink and eyes go blind. And if that wasn't enough, the stigma of leprosy is just as merciless. Rejected by family and friends, robbed of self-worth and dignity, people with leprosy are often forced to live as outcasts. But there is hope for people with leprosy. Now they can be treated with drugs, so they're no longer infectious. But they must receive treatment before the disease damages their faces, hands and feet. If we administer the cure in time, we can prevent nerve damage and disability. We can bring hope where once there was only fear and despair. All over the world, tens of thousands of adults and children are waiting for that cure. You can see the damage leprosy does when a person does not receive the cure in time. Disabilities make it difficult and often impossible to work. In addition, these visible signs of the disease can still cause fear and persecution from their family and community. Most people with leprosy keep their disease a secret for as long as they can. For patients whose bodies have already been damaged by leprosy, we do everything possible to care for them. We begin by giving them drug treatment to kill the bacteria. Then immediately we go to work to help restore, to heal and even to repair their bodies. For those we don't reach in time, we care for each patient, providing specialist treatment and counselling. On hands and feet that have been damaged by the disease, we perform reconstructive surgery. We can take a hand or foot that was almost useless and make it function again. Eyes, too. Prosthetic experts design and build artificial limbs and protective footwear. We share our expertise with local government, training health staff in leprosy diagnosis and treatment. Our centres in India and Nepal also invest in medical research into leprosy. When their bodies are healed, we help people to get a job, earn a living and support their family. I'm sure you can imagine their joy when after years of disability, a person can use their hands again. We equip people affected by leprosy with the tools to succeed. We train them in vocational skills like tailoring, mechanics and bag making. They learn a trade and become self-supporting. We even provide microloans to help them start small businesses. TLM is committed to sustainable poverty reduction, and projects like these centre on helping people to help themselves, encouraging them to actively participate in their self-development. In all of our projects, the goal is empowerment. Children from leprosy-affected backgrounds are keen to learn, but poverty and stigma often hinder them. We support these children, providing scholarships, uniforms and school materials. People affected by leprosy are amongst the poorest of the poor, often living in dilapidated makeshift homes without basic sanitation. Poor living conditions and water supplies lead to illness and disease, so we work to provide safe housing, water and sanitation. Where possible, we mobilise local governments to contribute to costs. The community often helps with labour, ensuring project ownership. Our holistic approach mirrors the care and concern that God has for every part of our lives. The Leprosy Mission upholds the Universal Declaration of Human Rights, educating marginalised people about their rights and empowering them to challenge injustice. We work in partnership with organisations managed by people affected by leprosy, supporting them to advocate nationally and internationally on human rights issues, promoting dignity and justice for all. TLM's dedicated partners in-country are nationals, ensuring insight into local culture, language and needs. Our in-depth understanding of regional issues enables us to develop projects that are timely, relevant and effective. Our network of partners enables us to share insight and learning and to access up-to-date information. From roundtable discussions to global surveys, we're able to facilitate best practice at all levels. Effective communication and monitoring systems with our partners ensure fast, accurate response times for reporting. The Leprosy Mission, in the name of Jesus Christ, is making a difference, but we could do more with your help. Please consider discussing further with us how your church could partner with TLM to transform the lives of people affected by leprosy. Hello, this is Wendy Craig. I feel proud to be associated with such an excellent and dedicated organisation which provides first-rate services for some of the world's most marginalised people. Leprosy is a terrible disease that robs people of their identities. There is a powerful lie based on fear and lack of education that someone affected by leprosy is not so much a person as they are a health threat. We must have the courage to challenge this lie, to offer treatment and rehabilitation in place of the rejection that many have come to see as the norm. This is why I support and will continue to support this work.